Good day to everyone watching this video. Today we'll be talking about three common skin infections with their cause, symptoms, treatment, and prevention. First, we must know what skin infection is. Your skin is the largest organ of your body. Its function is to protect your body from infection. Sometimes the skin itself becomes infected. Skin infections are caused by a wide variety of germs, and symptoms can vary from mild to serious. We will learn more about three common skin infections and what to do if you have one. The first, boils or furuncle. Furuncle is another word for a boil. Boils are bacterial infections of hair follicles that also involve the surrounding tissue. The infected hair follicle can be on any part of your body, not only your scalp. When the hair follicle becomes infected, it appears inflamed, as you can see in the picture below. The furuncle looks like a red raised bump on your skin that is focused on a hair follicle. If it ruptures, cloudy fluid or pus drains out. There. Next are its symptoms. Boils can occur anywhere on your skin but appear mainly on the face, back of the neck, armpits, thighs, and buttocks. Hair-bearing areas where you're most likely to sweat or experience friction. Signs and symptoms of a boil usually include a painful red bump that starts out small and can enlarge to more than 2 inches or 5 centimeters, red swollen skin around the bump, an increase in the size of the bump over a few days as it fills with pus, and development of a yellow-white tip that eventually ruptures and allows the pus to drain out, as you have seen on the picture before. Let's move on to the causes. Most boils are caused by Staphylococcus aureus, a type of bacterium commonly found on the skin and inside the nose. A bump forms as pus collects under the skin. Boils sometimes develop at sites where the skin has been broken by a small injury or an insect bite, which gives the bacteria easy entry. Next is the treatment. Treatment for stubborn furuncles or boils generally includes steps to promote drainage and healing. Warm compresses can help speed the rupturing of a furuncle. Apply a warm, moist compress throughout the day to facilitate drainage. Continue to apply warmth to provide both healing and pain relief after a boil has ruptured. You may wash your hands as well as the boil site with an antibacterial soap to avoid spreading the staph bacteria to other areas of your body. You can also contact your doctor if your furuncle remains unruptured or if you're in severe pain. You may need antibiotics as well as incision and drainage to clear the infection. And lastly, your doctor may also elect to manually drain the boil with sterile instruments in their office. Don't try to open it yourself by squeezing, pricking, or cutting the boil. This can increase your risk of deeper infection and severe scarring. Let's move on to its prevention. It's not always possible to prevent boils, especially if you have a weakened immune system, but the following measures may help you avoid staph infections. First is to wash your hands regularly with mild soap, or you may use an alcohol-based hand rub often. Careful hand washing is your best defense against germs. You can also keep wounds covered. Keep cuts and abrasions clean and covered with sterile, dry bandages until they heal. Avoid sharing personal items. Don't share towels, your sheets, razors, clothing, athletic equipment, and other personal items. If you have a cut or sore, wash your towels and linens using detergent and hot water with added bleach and dry them in a hot dryer. Now let's move on to the second common skin infection, the chickenpox. Chickenpox is also called varicella, characterized by itchy red blisters that appear all over the body. A virus causes this condition. It often affects children and was so common it was considered a childhood rite of passage. It's very rare to have the chickenpox infection more than once. As you can see in the picture, you can see the red blisters on a child's body. Next is its symptoms. An itchy rash is the most common symptom of chickenpox. The infection will have to be in your body for around 7 to 21 days before the rash and other symptoms develop. You start to be contagious to those around you up to 48 hours before the skin rash starts to occur. The non-rash symptoms may last a few days and include fever, headache, and loss of appetite. 1 or 2 days after you experience the symptoms, the classic rash will begin to develop. The rash goes through 3 phases before you recover. This include you develop red or pink bumps all over your body. The bumps become blisters filled with fluid that leaks. And the bumps became crusty, scab over, and begin to heal. The bumps on your body will not all be in the same phase at the same time. New bumps will continuously appear throughout your infection, and the rash may be very itchy, especially before it scabs over with a crust. You are still contagious until all the blisters on your body have scabbed over. The crusty scabbed areas eventually fall off. It takes 7 to 14 days to disappear completely. Next will be the chickenpox causes. The varicella zoster virus causes the chickenpox infection. Most cases occur through contact with an infected person. The virus is contagious to those around you for 1 to 2 days before your blisters appear. The VCV remains contagious until all blisters have crusted over. The virus can spread through saliva, coughing, sneezing, in contact with fluid from the blisters. So what is its treatment? A virus causes chickenpox, so antibiotics can't treat it. But antibiotics are needed if bacteria infect the sores. This can happen when kids scratch and pick at the blisters. Your doctor can tell you if the medicine is right for your child. So to help relieve the itchiness and discomfort of chickenpox, you can use cool, wet compresses or give baths in lukewarm water every 3 to 4 hours for the first few days. For this can relieve itching. And baths do not spread rash. You can pat but don't rub the body dry. You can also put calamine lotion on itchy areas, but don't use it on the face, especially near the eyes. You can ask your doctor or pharmacist about pain-relieving creams to apply to sores in the genital area. And lastly, you can ask the doctor about using over-the-counter medicine to take by mouth for itching. Okay, so the third skin infection, will be the athlete's foot. Athlete's foot is a contagious fungal infection that affects the skin on the feet. It can also spread to the toenails and the hands. The fungal infection is called athlete's foot because it's commonly seen in athletes. So, what are the causes of athlete's foot? Well, athlete's foot occurs when the tinea fungus grows on the feet. You can catch the fungus through direct contact with an infected person or by touching surfaces contaminated with the fungus. The fungus thrives in warm, moist environments. It's commonly found in showers, on locker room floors, and around swimming pools. So it's best if you avoid going through those places as much as possible. So there are many possible symptoms of athlete's foot, which include itching, stinging, and burning between your toes or on the soles of your feet. There might be blisters on your feet that itch. There could also be cracking and peeling on the skin of your feet, most commonly between your toes and on your soles. Dry skin on your soles or sides of your feet. There could also be raw skin on your feet. Other symptoms are discolored, thick, and crumbly toenails, and toenails that pull away from the nail bed. So, what can we do to treat the athlete's foot? Athlete's foot can often be treated with over-the-counter topical antifungal medications, or you can use home care, wherein your doctor may recommend that you soak your feet in salt water or diluted vinegar to help dry up blisters, which is very effective, by the way, if you want to do this or if you want to save up your medical expenses. You can also try the alternative therapy, which is tea tree oil. And this kind of oil has been used as an alternative therapy for treating athlete's foot with some success. To prevent athlete's foot, there are several things you can do. First, wash your feet with soap and water every day and dry them thoroughly, especially between the toes. Wash socks, bedding, and towel in water that's 140 degrees Fahrenheit or higher. You can disinfect your shoes by using disinfectant wipes or sprays. You can also put a famous one, antifungal powder on your feet every day. And of course, obviously, don't share socks, shoes, or towels with others. And wear sandals in public showers, around public swimming pools, and in other public places. Just like I said a while ago, it's better to prevent going around those public places. But if you cannot avoid it, then wear sandals. You can also wear socks made up of breathable fibers, such as cotton or wool, or made out of synthetic fibers that wick moisture away from your skin. You must also change your socks when your feet get sweaty. And air out your feet when you're at home by going barefoot instead of wearing socks. Wear shoes made of breathable materials. And alternate between two pairs of shoes to give your shoes time to dry out between uses. Like, for example, wearing each pair every other day, because moisture will allow the fungus to continue to grow. So, to summarize everything, the three common skin infections that I have mentioned are: the first one is the boils or the furuncle. The second one will be the chickenpox. And the third is the athlete's foot. So that's all for today's video. about the 3 common skin infections with their cause, symptoms, treatment, and prevention. So thank you for watching.